Hello everyone, welcome back to MedMate. Today we are going to be talking about osteology in the first module of anatomy. Now, osteology might be a little bit difficult for some of you once you are beginning anatomy, but you have to remind yourself that once you are done with osteology, you've learned a lot of terminology that you'll use later in the other lessons and in the other modules of anatomy. So when you're learning different structures, you're not only learning those structures, but also you're getting introduced to other names that will come handy when you're learning, for example, vessels, nerves, and other parts of the body. Today, as you know, we are going to be talking about vertebral column, and vertebral column consists of 33 bones, and in between each of them we have intervertebral disc, which is working like a cushion. Now, if we were to partition each part of the vertebral column, then I could tell you that we have the first segments consist of 7 vertebrae, and that's called cervical vertebrae. The second section consists of 12 vertebrae and is called thoracic vertebrae. The third section is lumbar vertebrae, which is handling the most of our body's weight, and is about and it consists of 5 vertebrae. And the last part is sacrum and coccyx. Both together they are about 5 fused vertebrae, and now we call them sacrum. Alright, what are the main or important part of a vertebrae? Now here we're talking about a typical vertebrae. Now, each typical vertebrae consists of a body, so is in the center, and now we are looking at from above. So this is superior view of this vertebrae. We have the spinous process, which is located in the posterior, and even you can feel it on your own if you touch the C7, C6, that these two parts of your cervical vertebrae is palpable, and if you put your hand you can feel that part, and that's the spinous process. Now we have also transverse processes on both sides, and this whole part of the vertebrae is called vertebral arc. And the vertebral arc, it has two main parts, that is in fact connecting transverse process to the posterior or the spinous process is called lamina, and another part which is connecting the body to the transverse process is called pedicle. We have also superior articular process, and there is also inferior articular process, but you cannot see that because we are having the superior view of the vertebrae. So in fact, superior articular process is articulating with inferior articular process of the superior vertebrae. We also have a vertebral foramen, and the spinal cord is running through this foramen. Alright, let's talk about clinical relevance of that. So earlier I told you about intervertebral disc, and if there is a huge amount of pressure on intervertebral disc, then we'll have herniation of intervertebral disc. Now, the intervertebral disc consists of 2 parts. The inner portion is called nucleus pulposus, and the outer portion is called annulus fibrosus. Now, when there is a rupture to annulus fibrosus, this nucleus pulposus can get out. Now, if there is this rupture, for example, here in this part of the intervertebral disc, then this nucleus pulposus will push the nerve roots or the spinal cord, and that causes the occurrence of symptoms of this herniation. Alright, now let's talk about classification of vertebrae. I told you that the first section of vertebral column is cervical vertebrae. And what are some of the main components of this part? Well, we have the bifid spinous process. So here you can see that there is a bifurcation, and that's typically seen in typical cervical vertebrae. So one of the most important signs of cervical vertebrae is that you can observe bifurcation in their spinous process. Another one is transverse foramina. Here you can see transverse foramina, and through these transverse foramina will have they give passageways to the vertebral artery and vertebral vein. So they are basically important clinical parts for us. Triangular vertebral foramen also is another sign that can indicate that this vertebrae is cervical vertebrae. So you can see that the vertebral foramen has a triangular shape to it. Now, 3 cervical vertebrae are unique and they are called atypical vertebrae, so they are not typical. C1, C2, and C7. Now let's discuss why are they unique, why are they different. So the first one, C1, here you can see cervical vertebrae number 1, and that's because I think you can notice that yourself, that something is lacking. And that's the absence of body. There is no body in the first vertebrae. And about C2, the body has a different shape. I mean, if you compare this vertebrae, which is typical vertebrae, with this one, you can see that there is another type of body in this vertebrae, and that's called dense process. All right, so you know that the other names for him is atlas and axis. So we call C1 atlas and axis is C2. This is just another name for first and second cervical vertebrae. Now, the last unique vertebrae that we can see in cervical vertebrae is C7. And C7, I told you earlier that cervical vertebrae have this bifurcation in their spinous process, and there is no bifurcation in C7. All right, now let's talk about thoracic vertebrae. I told you thoracic vertebrae are located in the second section, and they are articulating with our ribs. So there are two types of facets that are important: demifacets, demicostal facets. They articulate with the head of vertebrae, and so what you have to mind is that superior costal demifacet of inferior thoracic vertebrae is communicating with inferior costal demifacet of superior thoracic vertebrae. So they both together, once they are both together, imagine that there is a superior thoracic vertebrae, and this thoracic vertebrae is having a inferior demifacet, and these two both together communicate with head of the ribs. Now, inferior costal demifacet is communicating with another thoracic vertebrae, and they both together make the facet for the head of vertebrae. There is also transverse costal facet, which is joined together with the shaft of the rib. Alright, now the spinous process of thoracic vertebrae are oriented obliquely. As you can see, they are sort of inferiorly located, and they are going towards posterior surface. Alright, now let's talk about atypical thoracic vertebrae. Atypical thoracic vertebrae are T1, T9, and T12. And that's because, for example, when we are talking about T1, you can see the photo here, it has a complete costal facet for the head of the rib. So T1 is an exception, and it's articulating directly with the head of the ribs of the first rib. Another exception is T9. You can see that here, and T9 has no inferior demifacet. As you can see, there is only superior demifacet, and there is no inferior demifacet. T10 often shares features of T11 and T12, and T11 and T12, both of them consist of only one demifacet in the center. And there is also no transverse costal facet in T12 and T11. So you can see that there is no costal facet or transverse costal facet for the T11 and T12. All right, now lumbar vertebrae. Lumbar vertebrae consist of 5 vertebrae, and they are the largest in the vertebral column. Very large bodies are indication of this vertebrae, and their body is kidney shaped. You can see that here. And also, they also have this triangular vertebral foramen. Now, before I tell you about clinical relevance of that, I'd like to tell you about a specific parts of lumbar vertebrae. So here you can see spinous process, as you saw it in other kind of vertebrae. We also have the lamina, pedicle. We have the transverse process, 2 transverse processes, and then we have the superior articular facet. Here, it's not indicated, but this part of the lumbar vertebrae is called mammary processes. We have 2 of them. One of them is here, one of them is here. And also we have accessory processes. I think you can see that better here in this part. This is the accessory process of lumbar vertebrae. So I told you earlier that we have 2 articular processes, superior articular process and inferior articular process. Since we are having the lateral view of a typical lumbar vertebrae here, you can see that there are 2 of them. You can see again the pedicle here, which is connecting the vertebral body to the transverse process. All right, and now let's talk about clinical relevance. So lumbar vertebrae have a very distinct clinical relevance, and that's because their size and orientation give us this opportunity to get access to the spinal cord. Now, this can be due to different reasons, for example, epidural anesthesia or administration of lumbar puncture. So we usually do this via lumbar vertebrae, and this cannot be reached, for example, when we are talking about thoracic vertebrae. Now let's review the topic with some questions. So here, from which region of the vertebrae column is this vertebrae? Identify the indicated structure. So what do you think? What kind of vertebrae do you think you can see here? So what I see is that there is a huge body here, and also it's kidney shaped, and also we have these like big transfer processes. There is no demifacet. I cannot see any demifacet, and also we have this triangular vertebral foramen. So what I believe is that this vertebra is coming from lumbar vertebrae. Now, number 1 is the body of the vertebrae, transverse process, and a spinous process. From which region of thoracic vertebrae column is this vertebrae? Identify the indicated structures. So, what I can see here is there is a body, there is a circular vertebral foramen, there are some superior costal facets, there is transverse process with a costal facet, and there is an oblique spinous process. So these are all indications for the thoracic vertebrae. Now let's name the parts that are numbered. Number 1 is superior costal facet. Number 2 is pedicle. Number 4 is lamina. Number 3 is transverse process. Number 5 is spinous process. 7 is vertebral foramen. 8 is vertebral body. 6 is costal facet, superior articular facet, and inferior articular facets. Then we have 6 costal facet, and then we have superior and inferior costal facet. All right, now let's talk about sacrum and coccyx. You know that sacrum is collection of fused vertebrae, so there is only one sacrum here we can see, and the underlateral walls of the sacrum are facet for articulation with the pelvis. The sacrum is making the posterior wall of the pelvis, and the joints that it is connected to the iliac is sacroiliac joints. Now, here we are having the posterior view of the sacrum. Let's go through some of the anatomical structure of it. All of these foramina are sacral foramina. We have articular process. And here we have the entrance of sacral canal. The nerves C1 to C4 go through this canal. Then we have sacral hiatus here. We also have the sacral tuberosity in these two parts. We have the lateral sacral crest and median sacral crest. So two sacral crests. One of them is lateral, another one is medial. Then we have sacral cornu. They're seen here in these parts, and also you can see it better in here. Now we have the coccyx, which is usually consists of 4 to 5 bones. In the lateral view of the sacrum, you can see the auricular surfaces here. You can also see the lateral crest, which is here, and also the medial. This is the medial sacral crest. There are two curves. One of them is the sacral curve, lordosis and kyphosis. This part of the, first of all, you have to know that the head of the sacrum is called base, and the the ending portion of the sacrum is called apex, and it's vice versa. So this part is apex, this part is base. Now on the base of the sacrum, you can see these sacral premonitory, and here in these parts, you can also observe the ala in the anterior view of sacrum. So also you can see the transfer lines in the anterior view of the sacrum. And also sacral foramina can be seen from the anterior view of the sacrum. Alright, let's do some more quizzes. So here you can see a clinical relevance of the topic you're studying. Identify A and B. Identify indicated structure. So here you can see a photo CT scan of a vertebrae. What do you think a number 1 can be? Now, number 1 is the spinal cord, and 2 is the herniation of the intervertebral disc. I told you the inner portion is nucleus pulposus, and annulus fibrosus is the outer portion of the intervertebral disc. And this herniation, they are putting pressure on the spinal cord. Now, I think I've named all these structures here. Which region of the vertebral column is imaged in these radiographs? Identify the indicated structures. Alright, so here you can see the lumbar vertebrae, and what we can see, number 2 is the spinous process and the body. So number 3 here is in between two vertebrae. Here you can see the intervertebral disc. Number 4 is indicating body of the vertebrae. Number 2 is indicating the spinous process of the vertebrae. And number 1 is probably showing the transverse process or pedicle. Now let's talk about the ribs. Now, typical ribs are, all of them consist of a neck, which is here, a head, which is articulating with the demifacets or the costal facets on the thoracic vertebrae, and the neck, which has this specific part called tubercle, and this part of the rib is articulating with the costal facet on the transverse processes of thoracic vertebrae. And also you have the body, which is here. There is also an angle and a costal groove, and the intercostal artery and intercostal veins and nerves are passing through this groove. So, what are the atypical ribs? Now, rib number 1, number 2, 10, 11, and 12 can be described as atypical ribs. Why? Because they have some differences, they have some specific structures that are different from other ribs. Now, rib 1 is shorter and wider than the other ribs. You can see rib number 1 here. You can see how short it is and how wider it is in this part specifically. And that's because subclavian vein and subclavian artery are passing through these grooves that are located on these rib number 1. You can also see the tubercle on rib number 1. Alright, now The other atypical ribs are rib number 2, and that's because it's thinner and longer. You can see rib number 2 here. And also this rib has a specific tuberosity, and that's the region where the muscle serratus anterior is connected with the second rib. Now, other atypical ribs are rib 10, which is because it has only one facet, and also rib 11 and 12, and they don't have neck and only contain one facet. You can see rib 12 and 11 here, and rib 10 is very similar to rib 11, but it has the neck, but it has only one facet. Now, articulation of ribs with the thoracic vertebrae. For each rib there is anterior and posterior articulation. Now we are talking about posterior articulation. Now we have two joints. One of them is costotransverse joint and costovertebral joint. Now costotransverse, as the name is implying, is in here. So costal, in another word, ribs are articulating with the transverse of the vertebrae, and we have the costovertebral joint, which is located here with the superior and inferior demifacets. Now, I told you earlier that this part of the ribs are called tubercle. Now, let's have an anterior view on the attachment of the ribs. Rib 1 to 7 are independently connected to the sternum. So from rib 1 to all the way down to the rib 7, they are independently connected to the sternum themselves directly. While ribs 8 to 10, they attach to the costal cartilage. So 8, 9, 10, they are connected to a costal cartilage, and they both all together connected to the sternum. Ribs 11 and 12 do not have anterior attachment and end in the abdominal musculature, and because of this they are sometimes called floating ribs. Now, clinical relevance of that is that if there are more than 2 fractures occurring in adjacent in that area, then the ribs cannot control the thoracic wall, and the muscles cannot work correctly, and it displays a paradoxical movement during long inflation and deflation, and this condition is called flail chest. That happens due to trauma or when there was an accident, for example, and it leads to the impaired full expansion of the rib cage and thus affecting the oxygen content of the blood. And also there might happen a pneumothorax or hemothorax because of the fracture that is caused by the rib breakages. Alright, now parts of the sternum. Now, sternum is divided into 3 parts. We have the manubrium, we have the body, and we have the xiphoid process. Now, manubrium is the upper portion of the sternum. As you can see here, we have different structure in manubrium. One of them is the jugular notch. And on these parts of the manubrium is articulating with the clavicles and forming the sternoclavicular joints. So this part is the sternoclavicular joints. The body of the sternum is flat and elongated, and is the largest part of the sternum, and it articulates with the manubrium superiorly from this portion, and it's called manubrosternal joint. Manubrosternal joint is located here, and it is also articulating with the xiphoid process via xiphosternal joint. The last part is the xiphoid process, and it's the most inferior and the smallest part of the sternum. Clinical relevance of that is that there are some fractures related to sternum, and there is a high mortality rate if there is a fracture to sternum. They have 20 to 45 mortality rates, and that's not because of this fracture itself, but that's due to the matter of fact that the fracture of sternum can cause injury to lungs or to the heart. Now, because of this, it is very important and crucial when patients are those patients that have undergone, for example, a vehicular accident, they have to be checked via CT or a X-ray to confirm that there is no sternal fractures. Now let's review some questions. From which region of the vertebral column is this vertebrae? Identify the indicated structure. So what do you think? Here you can see a vertebra, and the first thing that I notice is the bifurcation in their spinous process. Then we have this body, we have the triangular shape of the vertebral foramen, we have the transverse processes with foramen. Here we can see the body of this vertebrae. So this vertebrae is from the cervical vertebrae. Now, identify A and B, identify the indicated structures. So, I think we have spoken about this photo in previous slides. I told you that the outer portion is annulus fibrosus and nucleus pulposus is in here. There is a rupture of annulus fibrosus and nucleus pulposus gets out. This is the herniation of intervertebral disc, and that's pushing the spinal cord. Alright, I hope that it was clear for you. We'll see you in next videos.